When the polio vaccine was first introduced in 1955, it was a game changer for that pandemic, and it eliminated polio in much of the world. We might have hoped for the same with the COVID-19 vaccine, but we now know continued booster shots are our current reality. Angela Rasmussen says to understand why, we need to know how the viruses and vaccines are different. She's a virologist and researcher at VIDO with the Vaccine and Infectious Disease Organization in Saskatoon. Thank you for being here.
Thanks so much for having me.
So why and how did the polio vaccine work so effectively that it actually put an end to that pandemic?
So this is, I think, something that people really need to understand when making comparisons with polio. A lot of people have said about the COVID vaccines that we're never going to get rid of COVID using vaccines because the vaccines aren't sterilizing. They don't prevent you from actually getting infected. But the original polio vaccine that was developed by Jonas Salk, the inactivated polio vaccine, actually doesn't produce sterilizing immunity either. Polio is a very different virus in general. It causes infection by a different route. It is a gastrointestinal virus. And what causes paralytic poliomyelitis, the disease caused by poliovirus, is when that virus gets out of your gut and into your central nervous system. The vaccine doesn't prevent infection by poliovirus, but it prevents the virus from getting into your central nervous system, which is how that vaccine was incredibly effective at eliminating polio in many of the countries that got it. It's also worth pointing out, though, Sam, that the polio vaccine also requires more boosters. So it's not a one and done vaccine either, at least not the Salk vaccine.
So what's different about SARS-CoV-2 and COVID-19 vaccines?
So a big difference with SARS coronavirus 2 and the COVID-19 vaccines is the fact that SARS coronavirus 2 is a respiratory pathogen. You get it in your respiratory tract. And in general, it's just very difficult to make vaccines that are completely protective against respiratory viruses. This is why you often need to get another flu shot every year. This is why the flu shot also doesn't necessarily completely protect against infection. So there's that. There's also the issue of the variants. So unfortunately, SARS coronavirus 2 has been spreading globally and has been for 2 years now. That gives the virus a lot of evolutionary space to work with. And unlike poliovirus, the SARS coronavirus 2 antigen, the spike protein that the vaccines protect against, really is a lot more plastic. It's much more slippery, so it can change a lot more as far as your immune system is concerned. That makes it very, very difficult to formulate vaccines that can really keep up with all of the variants of SARS coronavirus 2 that are emerging.
Well, that leads me to my next question, which is, will we continue to use the current vaccines that we have in circulation, or will we see new vaccines developed to battle those variants?
So certainly all of the vaccine manufacturers are currently developing variant-specific vaccines. And I think with the Omicron variant, this has become more urgent than it has been in the past. They were already developing variant-specific vaccines as far back as last year around this time when the Beta variant emerged. Prior to Omicron, Beta was the most immunologically distinct variant that had emerged. And what they found in those studies was Moderna did a trial comparing a third booster with the original recipe vaccine versus a Beta-specific booster, and there was really no difference. Both of them improved immune responses against the Beta variant. Now, Omicron, though, is substantially different from the Beta variant. And while the original recipe vaccines are still working very well as boosters, they're really boosting up the protection against both infection and against severe disease. There is some data coming in that does indicate that perhaps Omicron-specific boosters are going to be needed in the future, since it does look like that is the dominant variant currently in Canada and in the rest of the world.
In most cases, 2 doses means you're fully vaccinated unless you got the one and done shot. Some people feel like they don't need to get boosters. What are the consequences if people don't continue to get boosters?
So prior to the Omicron variant emerging, 2 shots did look like it was holding up very well against both infection and severe disease. There was a little bit more breakthrough with Delta. However, the 2 shots were still providing very robust protection against that variant. With Omicron, everything has changed. So Omicron is substantially different enough as far as your immune system is concerned that it really can get around the protection provided by those 2 shots. But the good news is that that data very clearly shows that a third shot really does provide a significant increase in protection against not only infection, but also against severe disease. It really, really significantly cuts hospitalization. It cuts mortality. So people who have 2 shots, certainly that's better than none. But I would really encourage everybody who thinks that, they might not need a booster or it's optional to go out and get one, because clearly in Canada, cases are on the rise and they're all being caused by BA1 or BA2, both of which are Omicron sublineages.
Thanks so much for your time and for your work, Angela.
It's my pleasure, Sam. Thanks so much for having me.